Good morning, good afternoon, and good evening, everyone. Welcome to another week of Global Cafe. My name is Natalie Mistry, Senior Policy and Project Coordinator here at the IFA. And today I'm very excited to be introducing you all to Dr. Varshini Varadaraj on the topic of aging with vision loss and improving access to care. Dr. Vardaraj is a research associate at the Johns Hopkins Disability Health Center. She completed her medical education and ophthalmology residency in India before earning her Master of Public Health from the Johns Hopkins Bloomberg School of Public Health, specializing in epidemiology and biostatistics. Following her formal education, Dr. Vardaraj underwent postdoctoral research training at the Wilmer Eye Institute at Johns Hopkins School of Medicine. Her research focuses on enhancing the health of older adults with disabilities, particularly those experiencing vision loss. With over a decade of research experience, Dr. Varadaraj investigates disparities in health, healthcare access, and community participation for individuals with vision impairment. Her work encompasses two interrelated areas, aging with vision loss and ensuring equitable access to care. Through a data-driven approach, she aims to address these critical issues and improve health outcomes for people with vision loss. So thank you so much today for joining us, Dr. Varadaraj.
Thank you so much for having me. I'm happy to be here.
So you're coming from several strong backgrounds, such as from public health, medicine, eye health, disabilities, aging, and equitable health. I would love to know what brought you towards the current work that you do today.
No, of course, thank you. My journey began in medical school and ophthalmology residency in India. And as a resident, apart from being in clinic and in the operating room, my training included weekly what we call cataract outreach camps conducted in disadvantaged rural and semi-urban areas around the city. And the sheer number of people, especially older adults with vision impairment and blindness, um, who were disconnected from care was truly sobering. And in clinical settings, we often see one patient at a time, but so many people never make it to the clinic due to various barriers to access. So after all those years studying medicine, I understood that to truly impact communities, we need to be able to see beyond the myopic lens, if you will, of clinical medicine. Um, that took me to pursuing public health, which gave me the skills and tools to integrate sort of my colliding interests in ophthalmology and community health. And then as a postdoc, you said it, one of my mentors was Dr. Bonnie Sweenor, who's now the director of the Johns Hopkins Disability Health Research Center. And her work had a huge influence on my research trajectory. While working with her, I became interested in the implications of aging with vision loss, how it affects daily functioning and health, and this converging of my interests in access to health services for individuals with vision impairment and the challenges of aging is sort of what has brought me here.
Amazing. That's incredible to kind of, see where you started and then kind of fall into the work that you're doing right now. It's really lovely when, you sense, the challenges, the issues that are going around you and, the ability to kind of hop in there and kind of start to influence change through the work that you do is quite incredible. And I also wanted to mention again, I think I forgot to mention in the beginning, this is again a nice part of our Global Cafe because it's right in advance of World Sight Day, which is happening on 10th of October. So this is quite lovely to have the session happening today. So in terms of eye health, a lot of your research focuses specifically on vision loss itself. Would you mind defining both sight and vision loss and how common it might be as we age?
Yes, of course. So the eye functions much like a camera. Light enters through the front of the eye, goes through the cornea, the lens focuses it, and it reaches the back of the eye where the retina lies. And then the retina then transforms that light, that's incoming light, into electric signals, which are sent along the optic nerve to the brain, allowing us to see. And in defining vision impairment, it's complex. There's many ways to define it, but one one way to categorize it to understand vision impairment is in terms of correctable and uncorrectable vision impairment. Correctable vision loss is when your eyesight can be improved with eyeglasses, contact lenses, or surgeries like cataract removal to remove the cloudy lens in the eye and put in an artificial intraocular lens that restores vision. On the other hand, uncorrectable vision loss refers to cases where vision cannot be improved with glasses or the removal of your cataracts, and it can result from eye diseases like glaucoma, um, which is damage to the optic nerve, uh, age-related macular degeneration, or diabetic retinopathy. Well, it's not that they can't be treated. We can often treat these conditions with eye drops, with injections, with surgery to prevent further vision loss. But any vision that has already been lost usually cannot be restored. And so understanding these distinctions helps us recognize the different parts in managing vision loss. We also this will be a helpful framework to keep at the back of your minds when thinking about how we define vision loss in research. So I'd like to highlight that the visual function system has many components, and so vision can be assessed through various different tests. Most of us are familiar with visual acuity, which measures the sharpness of our sight. This is assessed by reading letters of decreasing size at a fixed contrast, something everyone's likely encountered during an eye exam at a clinic. The World Health Organization and the American Academy of Ophthalmology in the US both use visual acuity to define vision impairment. So the World Health Organization uses a broad definition of presenting visual acuity that's worse than 20/60. And the American Academy of Ophthalmology uses a cutoff, more stringent, of best corrected acuity of 20/40. And however, as I said, the visual function system has many components beyond visual acuity. So, for example, near acuity is your ability to see close up when you're reading. The visual field test measures the extent of your vision in the periphery and in the center, and contrast sensitivity assesses your ability to perceive low contrast images. There's stereo acuity, which is your ability for depth perception. So, lots and lots of tests. And I won't get into the definitions of these measures, but just good to keep at the back of your minds because we use one or more of these measures while studying vision in aging research.
Yeah, that's a lot to consider. And so it's important to understand, I guess, that, vision impairment, vision loss can happen in any one of those kinds of types of, vision loss. Maybe it's your field of vision that might be, sort of closing in, or your depth perception might be slightly
Right.
off. So there's a bunch of different things to consider. And would it be right to say that, maybe more than one could be happening at the same time as well?
Yes,
Yeah.
absolutely.
Mhm.
It's an interplay between all these different aspects, and some conditions worsen some visual function measures worse than others, but they all sort of act together.
Absolutely. And what would you say is the most common form of vision loss or vision impairment as we age?
So the most common form of vision impairment everywhere in the world is refractive error, where which can be fixed with wearing eyeglasses, not specifically in the older population, but world over, about half of all vision loss can be corrected with just providing spectacles. As people age, there's certain eye conditions that become more common. Aging is a risk factor for them. So some of the conditions I mentioned, like age-related macular degeneration, glaucoma, diabetic retinopathy, but most importantly, cataracts, which is like a natural clouding of the lens that happens as we age.
Thank you for specifying that. Yeah, absolutely. And um, as vision loss, different aspects of our functioning, could you provide us with some examples of the relationship between vision loss and physical functioning, and then also between vision loss and cognition?
Sure. Let's just take a step back. So vision loss
For
can
sure.
impact aging, in several ways. In work led by Dr. Bonnie Sreenor, we created a framework that conceptualizes how vision impairment challenges successful aging. And in this framework, vision impairment has downstream consequences on different aspects of daily functioning, including what you said, which is physical and cognitive functioning, but also psychosocial functioning. Um, and so they considered downstream implications of having vision loss that in turn can result in adverse health conditions. And it's important to remember that this can be common risk factors that affect both vision as well as your brain, for example, with cognition. Um, but the personal and environmental factors play a huge role. So where you live and how accessible and socially supportive your community is makes a difference in how you conceptualize that relationship of vision loss leading to these downstream consequences. And pivoting to what you asked specifically about physical functioning, research shows that adults with vision loss walk significantly slower than those without vision loss. But it's not just about speed. Vision loss is also linked to greater difficulty with certain tasks, such as climbing stairs. And if we consider gait or our walking patterns, there are also changes there. So we've studied patients with age-related macular degeneration and glaucoma using a specialized walkway. It's essentially a high-tech carpet walkway that has sensors that track how people walk. And when patients are on this mat, we measured step length, how wide the distance is between their feet, what their walking speed is, how long they spend with both feet planted on the ground. It's called double support time. And our findings show that individuals with macular degeneration not only walk slower, but also spend more time with both feet planted on the ground, which implies that they're looking for more support while walking. And data, including from some of our recent work, also shows that poor vision, including acuity and contrast, is associated with less physical activity. We have lower total daily activity as well as more fragmented, shorter periods of physical activity compared to counterparts without vision loss. And you might wonder, why does it matter if people with vision loss walk a little slower or have altered gait patterns? Walking speed is actually a strong predictor of 5-year mortality for adults aged 65 and older. And gait changes can lead to balance issues, resulting in falls and fractures, which we know are serious concerns, especially for older adults. And reduced physical activity due to their mobility challenges can have cascading negative effects on overall health, cardiovascular health, mental well-being, bone density, among other factors that are very relevant for older adults. So that about some physical. Did you ask me about cognitive functioning as well? Okay.
I did, and I asked you about cognitive functioning, and then there's also a comment here from Dominic Boyd, who I think it fits in well, perhaps at the end of kind of when you discuss the cognition, where he asks, what are the challenges with dealing with vision loss and people who have dementia as well? So, I mean, if you want to kind of combine those two or just speak to either one first.
Yeah, of course. Thank you for the question. So, as we age, our brains undergo changes, leading to some decline in cognitive abilities. But our vision, which plays a critical role in how we experience and perceive our surroundings, can exacerbate that. Um, in a meta-analysis, which is a study that synthesizes all the studies in that area, found that vision impairment is associated with a twofold increased odds of having cognitive impairment. Um, and not only that, there's also double the odds of going on to develop cognitive impairment or dementia when vision impairment and cognition are examined over time. And that's quite substantial. If we dig deeper into what specific areas of cognition are affected by vision loss in dementia, in Alzheimer's disease and related dementias, we have found in our research that worse visual acuity and depth perception were linked to greater declines in language and memory scores. Meanwhile, poorer contrast sensitivity is associated with declines in not just memory and language, but also attention and visual spatial abilities. And this sort of suggests that the type of vision impairment that an individual might be experiencing and the underlying pathology matters in how it manifests, how dementia manifests. And I think this maybe answers the question that was posed. So, why might vision loss, be driving cognitive decline? Um, One possible reason is that vision impairment people with vision loss often engage in fewer cognitively stimulating activities like reading or doing a crossword puzzle, going out to a social setting, a game. And that can decline because that can decline with worsening vision. And in our research, we discovered that older adults with vision impairment participate in fewer cognitive activities compared to their peers without vision loss. And this decrease in engagement could put them at a greater risk of future cognitive issues and dementia. But apart from the decreased engagement, vision loss may be driving cognitive decline via several other interrelated factors. For example, reduced sensory input. So, less visual information is coming in due to your vision loss that limits cognitive processing, increased cognitive load. More effort is required for everyday tasks, leading to mental fatigue because everyone has a reserve, but the reserve is limited. And also, vision loss is linked to many conditions, as I said before, that also affects cognitive health. So, smoking, for example, diabetes affects the retina and the brain. So, just keeping that in mind, that there could be common causes that can result in both impairments.
Oh, fantastic. And Dominic, if you're still here, if you wanted to unmute, if that answers your question, or if you had anything else to kind of ask regarding that.
Yeah, I'm connected. I volunteer with our local Alzheimer's Society, and we're having a conference actually later this month. And I just felt I'd like to see what sorts of uh, things are happening when we have visual problems that would probably increase the amount of cognitive decline that people are experiencing. So, yeah, I think it answers the question reasonably well. So, thank you very much.
Thank
Perfect.
you for
Thank
the
you both.
question.
Incredible. All right. So I was wondering, kind of along the same lines of what we were talking about, but could you explain how vision loss might negatively affect social interactions and mental well-being?
Sure. So on this in the same framework of downstream consequences, vision loss can also impact mental and psychosocial functioning, as you asked. And several studies have shown that people with vision impairment often experience negative mental and social outcomes. For instance, in our recent work with older adults, in a nationally representative sample of older adults in the United States, we found that those with vision impairment had significantly higher odds of experiencing depressive symptoms, anxiety symptoms, as well as feelings of social and severe social isolation. And a recent paper further synthesizing data across 10 existing studies on these associations between vision loss and suicidal behavior found that vision impairment is associated with suicide ideation, attempts, and death. And these are sobering associations that underscore the importance of eye health on overall mental health and the potentially devastating consequences of insufficient support for people with vision loss. There's two pieces I'd like to highlight that may be resulting in the downstream mental health consequences. I think oftentimes the onus is put on the person with vision loss to get it treated, to fix it. But I think we sort of need to unpack the underpinnings of that and understand how um, the environment and society can sort of adapt to be better supportive of people with vision loss. So one aspect is this idea of stigma and discrimination. Stigma refers to negative attitudes, beliefs, perceptions that society holds towards a particular group of individuals based on characteristics such as their vision disability, for example, and it can lead to discrimination and social isolation. During the pandemic, we conducted a qualitative study via Zoom with older adults who had glaucoma and macular degeneration. And through these Zoom interviews, we uncovered many themes of internalized stigma. Many participants expressed concerns about how they are perceived in society and a desire not to evoke pity from others. It has also been noted that adults with vision impairment face more discrimination compared to their peers without such challenges. In work that's been done by some of my colleagues, participants have reported feeling being treated with less respect and often sense that other people viewed them as less intelligent as a factor of their vision loss. I'm sorry if you're hearing some
Oh, no.
background noise from my baby. Okay.
Oh, no.
Um, and yeah, and data in fact show that perceived discrimination is associated with higher levels of depressive symptoms and loneliness. Um, and the second piece, apart from the stigma and discrimination, is likely contributing to adverse psychosocial health for people with vision impairment is the lack of just inclusive, accessible, and supportive environments. Um,
Yeah, no, thank you for addressing that. It's really important to understand, that the environment makes such a huge difference on what it is, and perceptions, your own, not only other people's perception, but your own internalized perceptions, which really kind of changes the course of, how you might live the rest of your life, especially with, such kind of impairment. And so how would you say vision loss might impact health equity and access, for example? And I just want to tie in a question here from Shmuel, kind of along the lines of health equity and access, where he asks, what improvements to the access to the care of older adults coming from a more lower economic socioeconomic status, kind of along the lines of that, like how might that be a challenge for them as well?
no, absolutely. That's a great question. And right apt. And I'll tie that in as I discuss some of the issues around equity and access that you asked. So, in some recent work using nationally representative data from the US, these were telephone-based interviews, and we looked over some recent data, 2019 to 2021, and we found that adults with vision difficulty were more likely to not have healthcare coverage, not have a regular provider, not to have not had a healthcare checkup within the past year, and having foregone care due to cost. And these are results from adjusted models where we adjust for factors such as age, race, ethnicity, income, and education. And as I'm sorry, I forget the name, but as one of the audience members asked, we also saw that among people with lower incomes and lower poverty income ratios, that access is even harder. So there's definitely the need to examine these intersectional differences for people with lower incomes, because the people who often need it the most are most unlikely to not get it. Um, in other work where we looked over a cross-sectional period over nearly 10 years, we've also seen that while individuals with vision loss are more connected to eye care, which makes sense, as this is a factor of, you go to an eye doctor because you're having vision problems, um, but they also faced greater difficulties affording eyeglasses, which indicates clear gaps in healthcare access for, again, those who need it the most. Um, we we've also found that individuals with vision loss are less likely to receive important preventive health services outside of vision services, things like flu vaccines, breast and colon cancer tests. Um, Specifically, we found that women with vision impairment had an 18% lower likelihood of getting a mammogram in the past year, while both men and women with vision impairment were 11% less likely to undergo a colonoscopy compared to their peers without vision impairment. And this also translates to, I feel like now that the pandemic has happened, it always have to mention it, but using recent data, again, in a national representative sample of US older adults with vision loss were less likely to get vaccinated or tested for COVID-19. And related to this, I want to highlight some of the work we do at the Johns Hopkins Disability Health Research Center on examining disability inequities, including for people with vision loss, using what we call disability data dashboards. I believe that was the other resource we shared. And these dashboards are a way of providing disability information in an accessible way that everyone can use. And one of those was the COVID vaccine dashboard. We partnered with WebAIM out of Utah. They're experts in assessing accessibility of website content using a tool that they developed. And we assessed the number and types of accessibility errors on state health department websites in the US across the country. And we found errors such as contrast issues, among many others on these websites, highlighting barriers that people with vision loss and other disabilities may have encountered when accessing information and registering for the COVID-19 vaccine. And there was wide variation across states and degrees of errors. And so where you live, again, going back to the environment, could factor into how easy or difficult it may be to access the vaccine if you were blind or had low vision.
Oh, that's incredible. That's a lot to, really take into consideration with in terms of, not only just access in general, but equitable access for older adults, those experiencing, disabilities on top of all of that. And yeah, like the fact that, it really can impact their treatment. A lot of patients go lost to follow-up because they just can't simply attend or access care or things like that. So it's all very important to keep under consideration for what they're kind of going through at that point in time. And so I think you kind of touched on this, but beyond the realm of just, health of an older adult, could you speak to the impact that vision loss might have on equity and access, just in general, kind of outside health?
Yeah, sure. As you can imagine, outside of health as well, it's been well documented that there's other disparities in like community measures. One key issue that's very important is food insecurity. We've noted that low-income adults with vision impairment in the US face more than double the odds of being food insecure compared to their sighted peers. And again, thinking about why that may be, vision impairment may be driving food insecurity due to challenges with not only acquiring and preparing food, but also the accessibility and affordability of social services, right? Transportation to the grocery store, navigating online platforms for food programs, for example. And that's actually a good segue for me to highlight another one of our disability dashboards, the SNAP dashboard, or the Supplemental Nutrition Assistance Dashboard. To give everyone some background, the Supplemental Nutrition Assistance Program or SNAP is a federal benefit providing food assistance to millions of Americans. And this work was led by Dr. Laura Samuel and Dr. Bonnie Swinar, and we examined state SNAP websites for accessibility of SNAP enrollment and found very wide state-based differences and gaps in information available to individuals with disabilities, despite their legal entitlements to those benefits. So together with evidence showing disproportionate food insecurity burden among people with vision loss, these results suggest that they may be doubly disadvantaged with regard to food access because it's hard to access benefits that you're entitled to. And outside of food, there have been documented disparities in transport and how accessible transport is. In the realm of education, when examining the top National Institutes of Health funded higher education institution web pages, we found that most most have room for improvement in terms of disability, inclusion, and accessibility. The same goes for employment opportunities in the workspace. And in terms of financial well-being, which is central to having access to many things, we've noted that older adults with vision impairment are more likely to have credit card debt, for example, and rely on financial help from relatives. And so all this to say, we need inclusive solutions to bridge this divide in food security, transport, education, and economic disparities, even outside of health.
Absolutely. Thank you for kind of taking that through. It's important to consider, not just the health part, but everything else, because everything eventually kind of influences and impacts each other. So thank you for taking us through all of that. So I'm going to make my way towards some of the questions that we have in the chat. So if anyone has any questions, comments for Dr. Varadaraj, please post them in the chat, and we'll try our best to get through all of the questions today. I think the next one here we have from Brendan Sherlock. Brendan, do you want to unmute yourself, and if you wanted to ask your questions here?
Yeah, just to ask Varishi, the optimum time for eye tests, should it be 12 months? Should it be 6 months? So should it be 2 years, 5 years, whatever? And the other thing is, that maybe my real question is it a problem for older people to be on screens quite a bit? Does that deteriorate sight? Thank you.
Of course, happy to answer. In terms of the frequency of eye exams, it depends on the age of the individual as well as underlying eye condition pathologies that they might have. So for the recommendation is once someone hits 40 years, it's important to get your eyes checked every year to 2 years. And these recommendations, again, differ based on where you live and what eye condition you might have. But this is to encourage for two reasons. One is around the age of 40 is when this condition called presbyopia sets in, which is difficulty reading things up close. And this is because the lens in the eye is not able to stretch out and accommodate as well. So getting prescribed with reading glasses. And the other one is the incidence of glaucoma, which is a damage to the optic nerve that can happen, but sometimes an increase in eye pressure in the eye can also the risk increases once you sort of hit middle age. For older adults, the recommendation, so when I say older adults, I'm thinking 60, 65 plus years, is annual eye exams. So once a year, having an eye exam done. Now, if you have underlying chronic conditions like diabetes and hypertension, for example, that frequency increases. The recommendation could be every 6 months, again, depending on the severity of the underlying disease process. And the second question, sorry, what was the second? Mithali, could you remind me?
Yeah, for sure. I think he was asking more or less, things like screen time. Does that kind of
yes.
affect or impair vision? Yeah.
Yes, thank you for the reminder. Screen time plays a role, but it's oftentimes blown out of proportion in terms of what impact that has on the eyes. One thing to keep in mind is when you're staring at a screen, you're less likely to be blinking. And blinking is what causes the eyelid to move over the cornea to lubricate it. So you could experience some dryness in the eyes that can then be related to a headache and general like eye fatigue. So I think it'd be important to keep in mind to reduce screen time, take breaks, just to make sure that the eyes are being lubricated and you're not straining the eyes.
Perfect. Thank you. And I know, like in the chat, he wrote kind of what are precautions? Are there any precautions at all to minimize, vision loss or vision impairment?
Yes, I think getting regular eye exams and making sure that if drops are prescribed, if surgery is suggested, just sort of getting that in a timely manner and trying to ensure that you have the social support to sort of help with the treatment plan.
Absolutely. So yeah, just kind of understanding, why am I taking these drops? And okay, this might be helpful for this. So really communicating with your healthcare provider or even your family members. Sometimes I know when I used to work in an eye clinic, patients would come in and they're like, I didn't realize I had kind of lost a certain type of vision in this one eye until a situation happened. So it's always great to have that social support system around you and, continuously communicating with everyone. Yeah, absolutely. And just kind of on that chat trail over here, Mark Venning mentioned here in Canada, vision should be checked annually over the age of 65, especially if you've had any previous issues. Oh, great. He's having a test next week, which is great, and has already had cataract surgery. So he's on the roll, on the ball with all of that. So that's excellent. Yeah, but yeah, just as you mentioned before, location to location, things like requirements for annual eye exams might differ, and depending on what the condition of your eye might be as well.
Mm-hmm.
Absolutely. All right, and then we have another question here from Dominic Boyd, related to dementia again. So he says, or more of a comment or a question, says issues of people with dementia and vision loss being left out of social interactions, and we need more programs to kind of redress this. If you have any thoughts regarding that, Dr. Varadaraj?
No, absolutely. So I as I said, there could be multiple pathways that cause the cognitive loss that can happen with vision impairment, and absolutely one of them is trying to increase the social support and the social interaction that can then sort of ease the cognitive impairment. But we need interventional studies in that space to see if so. We now have cross-sectional data that shows that when you have vision loss, you're more likely to have cognitive impairment, and we also have data that show that over time, vision loss can be a risk factor for cognitive decline and dementia. But what we don't have is much of is interventional studies that say if we intervene at this point in someone's trajectory of vision loss or cognition in terms of cognitively stimulating activities, how does that then change the pathway or the trajectory for people with vision loss? So I think that would be that's a great next step.
Yeah, absolutely. And we have another question here from Taki Hemphill. And they ask, have you noticed any differences of vision loss between different older adult categories? So they mentioned young old, middle old, and oldest old.
So there's depending on the age bracket that people fall into, you're more likely to have certain eye conditions. As I said, refractive errors are very common, throughout the lifespan. They're often picked up in younger populations, pediatric populations, young adult populations, and when you're nearing 40, 45, the refractive error called presbyopia, where you need reading glasses. And then conditions like chronic conditions like diabetic retinopathy, glaucoma, etc., set in when people are a little bit older, maybe closer to 60, 65. And although it can happen earlier, depending on where you live and your genetic predilection, other risk factors that you might have, and apart from refractive error, the most common sort of correctable eye condition is cataracts. Everyone, if you live long enough, will develop cataracts. So eventually, we will all likely need cataract surgery. So yes, it can happen in your 40s. It can happen but it's most commonly occurs when someone's in their 60s.
Okay, good to know. And you don't really think about these kinds of things, so it's always important to keep it in the back of your mind. And so we have a question here from Eileen. Eileen, did you want to unmute and ask your question?
Yeah, thank you very much. And thank you very much for an excellent discussion so far. My question relates just really following on cataracts. What are the general guidelines as to when you should have surgery? We've been noticing with older populations, 70, 80s and 90, to say, well, they've been told, well, no, it's not developed enough to have surgery. And others are saying, well, no, it's as well to get it done now. And then they look at the other eye and say, well, in 2 weeks' time, can you come back and we'll get the other eye done? What are the general guidelines around that, if there's any?
The guidelines have, I feel like, are in constant flux in terms of exact recommendations, but to be honest, it depends on the individual and how the cataracts impeding daily functioning for that individual. So, and it depends on, say, their interests, what they like to do during the day, at night, what their profession, for example. So, if a patient was to come into the clinic and say, I have to drive at night and I'm unable to see clearly because it's a glare from the lights from oncoming traffic. In an instance that way, even if the cataract is not very well done, not very dense, the recommendation would be, okay, maybe you'll benefit from cataract surgery to improve your daily functioning and allow you to do the activities that you enjoy doing or need to do. There's also differences based on the treating eye specialist. It depends on where you live. In India, for example, where I was trained, we often saw people with very dense cataracts. And in those cases, we suggest surgery as soon as they're able to do it in both eyes. One eye followed by the other eye within a few weeks or a month or a couple of months, depending on what they're able to do. So yeah, to all this to say, it depends on the individual in terms of how the cataract is affecting activities that they do during the day.
Oh, okay. Can I sneak in another question, please? At the very beginning, you mentioned the gait as being one of the indications, and intuitively we would notice that. But the gait could also be affected by some lumbar issues or leg issues. Has there been any research on the treatment for the rehabilitation for those issues? And then has it affected the gait with people who are visually impaired? By the way, I have a bit of a hoarseness this morning, so my voice may not be coming across.
No, I can hear you very well, not to worry. I'm not as familiar with what research has been done in the rehabilitation space for spinal issues that could then affect how someone with vision loss their gait might improve or change. For the study that I mentioned, we actually, one of the exclusion criteria for the study was to exclude people that had other comorbid conditions, so spinal, like a lumbar issue, spinal condition that could be impacting their gait. So we actually didn't include other conditions in that analysis.
Yeah, that's quite interesting to consider for sure. We have another question here from Barry Spinner. If you wanted to pose your question. If not, then I can pose the question. So they ask, are there any dementia studies of individuals with both vision loss and serious hearing loss at the same time? And they ask because these two morbidities are quite common in older adults.
That's a great question. And yes, the answer is yes. As they pointed out, as we age, it's, we often the focus among like the ophthalmology community tends to be vision loss, and then in the hearing community, hearing, but these often coexist, and we call it dual sensory impairment. And we have seen that having one impairment versus the dual sensory impairment, there is an increase in the magnitude of cognitive impairment, as well as the risk of cognitive decline. Yes, there have been studies in that space, and they've documented that.
Quite interesting to know. Perfect. And then we have a question here from Deborah. Deborah, if you're on the line, if you wanted to unmute yourself and ask your question.
It's early morning. I think we're all a little groggy or grumpy this morning. And I have headphones on, so I sound really weird to myself. Yeah, I work with older adults. I am an older adult. I've been going through some of my own vision challenges, but I do work with a lot of people who I do see the social isolation. Their families may not be close by. We've had serious issues trying to access a connection with a vision loss organization, shall we say, that has limited resources. I'm in a big city. I'm in Edmonton, so it's a big city. A lot of them, it's macular degeneration. What else can I say? But I'm just looking at, obviously, we all, as we age, want to try and remain as independent as possible for our own sense. And also, the saying goes, we don't want to be a burden to anybody. But yes, there are some challenges around all of that. And I'm just trying to figure out how a family member or a friend or us as workers, what resources are available to help that senior to bridge between maybe where they're at, how things are going to progress. I see declines in ability to maintain their own home. They, see the dirt and the stuff piling up. So, but that provides other challenges because then there's risk of falls in the home. So yeah, is there some system or guideline? Again, the onus does come back pretty much on the person with vision loss, but as someone who works with these older adults, what types of things should we be looking to do or can help with?
Yeah, no, you're exactly right. Adequate social support for older adults often does not exist, and we need to sort of bolster that social support and social networks and connectedness so we can provide support to older individuals with vision loss, with activities that they find important, while also helping sort of preserve that independence. I think that it depends on whether the individual lives in an assisted living facility or their home. If they live with other people, a family member, what their social network looks like in connecting them and providing that support. In terms of resources, specifically, it's often limited. There's low vision rehabilitation services that are provided in clinic. For example, if someone was to come in and say, I need help with this particular activity, they could help and also help connect with social services to bridge that gap. But you also bring up a good point on we need research. We need research that looks at what social support services can be provided that again can change that pathway for people with older adults that are struggling with daily functioning and maintaining their independence.
Absolutely. And, again, specific supports can always kind of be found perhaps with your local government, things like that. There's always provision to a certain extent. So it's always a great idea, I think, to just chat with your, whoever's around you. And, you never know until you start speaking to someone or, reaching out. And, sometimes that's also difficult to do. So important to keep all these considerations in mind. And so I kind of had my own question to kind of pose just along the lines of that. So, there's a lot of research being done around aging and vision loss. But for yourself, what kind of research is really still needed at that intersection right now? What do you think is like kind of the next big thing that's happening in terms of that?
Yeah, great question. As I was just saying, we still lack sufficient interventional data that demonstrates how treating vision impairment can positively influence these aging outcomes as well as access to care outcomes. For instance, there's a few studies that have shown that surgical treatment of cataracts um, can lead to like a 50% reduction in falls and a 30% reduction in dementia risk. And we need more research on those lines to explore the broader benefits of vision screening and intervention for older adults. The growing number, as this demographic shifts as populations around the world age, the growing number of people with vision loss and the health related consequences has implications, right, for older adults, their families, caregivers, healthcare providers, policymakers. Um, to address this, we need interventional studies that also sort of take on a collaborative approach instead of being mired in our own lane of like, I do ophthalmology research or I do policy research, sort of like marrying all of that together. So optometrists and vision scientists and geriatric specialists and disability and health policy workers can all sort of come together to think of like innovative solutions to these expanding issues. And um, also to track with healthcare policy, there's many adults in the US and around the world that face barriers to accessing eye care. So how can we change policy to provide services that are more affordable and accessible? Yeah, and as someone pointed out earlier, it often impacts marginalized groups more than others, so including people in minority race and ethnic backgrounds, women. So it's also, I think, doing intersectional research is necessary to sort of understand how these disparities magnify based on who you are.
Yeah, I think that that type of research is incredibly needed just across the board. But yeah, especially with vision right now, having that kind of cross collaboration between different types of research, I think that could be quite revolutionary in terms of the way we look at, trying to find solutions for different issues. And I think I really hope that that does start happening a lot more. It'd be incredible to kind of witness that kind of change in research itself. Um, and just along the same lines of that, what kind of steps could be taken to be more inclusive towards those with vision loss in society?
Yeah, so one thing is to adopt universal design principles, whether it's designing research studies or hospitals or school campuses, public spaces, transportation systems. Um, just keeping universal design principles in mind, meaning creating an environment that's usable to everyone, regardless of their abilities. And they should also translate to website and digital accessibility. So when designing websites and apps, they should follow accessibility standards, offering screen reader compatibility, alternative text for images, so people with vision loss and other disabilities can engage with the content. And also just promoting inclusive education and employment opportunities. Um, so providing accessible materials at the workplace, inclusive hiring practices, and providing reasonable accommodations. So we're not discriminating or disadvantaging people with vision loss. And very important, but also just listening to individuals with vision loss, right? Including them, involving them, people with lived experience in discussions about accessibility and inclusion, when thinking about getting their voices when you're designing research studies, so co-designing research studies with the low vision population, and just because the insights will be valuable in creating effective and tailored solutions for them. So yeah, I think it all comes down to creating an environment where people with vision loss can participate in all aspects of life.
Absolutely. And I think that's kind of a great way to kind of end like that kind of thought process of, okay, what are the next steps? What are the things that we can do? Even Deborah just added a comment in the chat, and she says, you know, cities need to keep vision loss front of mind when they're planning roads, sidewalks, interaction with people, transportation systems. Where she's from in Edmonton, they recently added ground level light rail transit, so she can understand why those with vision isolate due to fear of injury while out and about. So again, in terms of that universal design planning, you know, really taking into consideration everyone's needs, especially those, you know, experiencing vision loss itself. So now that we are slowly coming close to the end of today's Global Cafe, and before we wrap up, I would love to hear your key takeaways from today's discussion. So I'll give you just a little time to gather some of your thoughts as I'll introduce our next week's topic and speaker right now. So please join our discussion next week with Mr. Jack Kupferman and Ms. Carol Agengo on the topic of supporting and advocating for the rights of older adults, which is in honor of International Day of Older Persons, which just passed on the 1st of October. So please join us next week for what will be a very important conversation about human rights of older persons. So I'll bring it back to you, Dr. Varadaraj, if you wanted to give us some of your key takeaways.
Yeah, absolutely. And once again, thank you for having me. It's been a pleasure talking to you. In terms of key takeaways, as the World Health Organization, states, almost everyone will experience at least one eye condition if they live long enough. And this really underscores the importance of designing inclusive and accessible programs and environments, not just for those with vision loss, but for everybody. And the focus for healthcare providers, researchers, and policymakers, funding agencies needs to be a shift from solely focusing on fixing vision impairment, which of course is important, but it's just one aspect, right? And we need to broaden our thinking to focus on creating a space and providing the supports that people with vision loss and other disabilities need.
Incredible. Thank you so, so much. Before we sign off, I would also like to thank again everyone for another great week of our Global Cafe sessions. Again, special thanks to Dr. Varshini Varadaraj and for joining us today. And great thanks to the incredible people working at the IFA who've supported this in every Global Cafe, in particular, Miss Luana Colnago. So thank you everyone for joining us. We hope to see you all next Friday and wish everyone a great weekend. So thank you. Take care.